Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about clinical digital photography and cameras. And I do cosmetic facial surgery. That's all I do. However, there are many types of physicians, dentists, other healthcare practitioners that take pictures. Pictures are so important. In cosmetic surgery, you cannot even converse about cosmetic surgery without pictures. Pictures serve as marketing for before and after pictures. They show results. They serve as the legal record. And one thing I've noticed all throughout my career is the best doctors take the most pictures. And when I put my before and after pictures together, which I tend to do at home at night, this is when I really see what kind of surgeon I am and what is good and what needs work. And just having pictures is critical. So if having pictures is critical, and I have 7,000 before and after pictures on my website and almost 100,000 pictures on my computer. So if having pictures is critical, having a good camera is really critical. Now, like many doctors, for a long time I used the large format 35mm cameras that had flashes and ring flashes and a long lens. And it was problematic because, first of all, it was bulky, it was cumbersome, you really couldn't throw it in your briefcase, it was hard to take from office to office or to the hospital. But most important, it was hard for my staff to operate. And usually I'm scrubbed, and when I need a picture, my staff is taking it. So Lesterdyne is a company that has made cameras for decades, and even when I had the larger 35mm cameras, they were Lesterdyne cameras. But what has really changed my photographic life, so to speak, are these small format cameras from Lesterdyne. Now, this is a Pentex camera, and it looks like a camera you could buy off the shelf. However, it is customized by Lesterdyne. What they do is they change the firmware and do other customizations to this. So it's a point and shoot camera, and basically it has two settings for what I need. Setting number one is for profile, so it's anything from a headshot down to the pupil. You could get a picture much better than this with this camera. The other setting is a full body setting, so if you do full body surgery or in that setting you can use it as a vacation camera. There's some pretty nice things about it. Number one, can't hurt it, all right? You can drop it from 6 feet. Number two, there's not many clinical cameras that you can do that with that are waterproof. So it's pretty much an indestructible camera, and again, it has fantastic micro capability all the way out to infinity. The flash is automatic, and when these cameras, these small format cameras first came out, it took a long time for them to focus, and sometimes the shot was blurry, but the microprocessors in these are great, and it's just boom, right on. So we're going to show you how we use this in our practice and some clinical pearls about digital photography, so stay with us. When we're discussing photography, what you really want to do is to make things totally simple. Now, I have friends that have photographic rooms in their office, and they're all set up, and that's the only place they take pictures, and they take very nice standardized pictures. The problem with that, it never works in my office. I've got people coming and going, and I take so many pictures. It would be just a nightmare to have to stop what I'm doing, take a patient, go out of the room, go to the photograph room, bring them back. It would just be a traffic jam. So what I do is I have a photographic background on each door in every room in my office. So I can adjust this for height. It is a photographic cloth, so it's non-reflective, and this is just a picture frame, and it's just on a little track. It was not expensive to make. And I can bring a picture. Now, since I only do head and neck surgery, this is great because when you zoom in or close up, you don't see anything else. If you do full body surgery, you can have a cloth on the entire back of the door, or you can use a wall. But it's very important to have a standardized background, and some things you want to control are, number one, your background, your lighting. Nothing irks me more than when I see doctors with deceptive photography. And they will take a before picture without a flash, so it shows all the detail. They'll take an after picture with a flash, which hides the detail, and that really makes their before and after pictures look good, except it also makes them look very fake. And You know, some doctors have deceptive photography by a mistake because they don't know better, but a lot of people do it on purpose, and it just, you go out on the internet and you see these cases for wrinkles and acne and various surgeries, and they're not standardized. The before picture, the head is this big. The after picture, the head is this big. There's shadows, there's flash, there's no flash. You want to standardize your pictures. That all starts with a proper background, the same lighting, the same distance, and the same focus. And we're going to talk about those now in a little bit more detail. We're going to use lovely Alyssa here for our model today. Now, the first thing you want to do when you take before and after pictures, you want to get any jewelry off, all right? If the patient has makeup, depending what you're doing, if you're doing skin resurfacing, you need no makeup in the before, no makeup in the after. If you are going to use makeup, which is okay for a lot of pictures, you just have to make sure you're using the same makeup. You want clothes that don't have a turtleneck. You want to be able to have a headband that's readily available to get the patient's hair off their head. And again, if I were to put this camera up here, boom, it's point and shoot, and there is my picture. Now, one mistake you see people make a lot is they'll get up like this to do a picture. They'll get very close to the subject. I don't know if you can tell, but her nose looks about 3 times bigger than it is because it's a fisheye effect. You do not want to do that. You want to step back, in this case probably about 2 feet, and you want to let your camera do the work. If you zoom in, it will have the normal perspective. However, if you hold it close, it is going to be skewed. So that's a common mistake people make and get that fisheye look. The other problem that's a common mistake is shadows. If I take a picture like this, I'm going to have a shadow on the profile because the light is coming in this way. I can simply turn my camera, and it depends where your camera's flash is, but in this case, I'm going to turn the camera upside down and zoom out just a little bit here. Remember, we can change all this in post-editing. And I'm going to take a picture, and now there's no shadow because the flash is coming in this way instead of this way. So that's very important also. Now, another thing, when you go to take a picture of a patient and you put a camera in front of them, their instinct is to stiffen up and to raise their brows and to smile. It's really important that who's ever helping you take the pictures helps the patient. So they'll say, relax your shoulders, relax your brows, don't smile. You want that patient totally relaxed in that picture. One other thing, when we take 3/4 views, it's very important to have your picture standardized. And the perfect way to do that in a 3/4 view is to line up the bridge of the nose with the medial canthus, all right? And by doing that and having the patient look over here, just so the bridge of the nose lines up with the canthus, and that way, that will always, in the befores and the afters, all your patients will be standardized, because otherwise they're looking too much that way or looking too much that way. So that's a great little way to standardize those views. And these are just a couple of the photographic pearls. We could talk all day about this, but it's so important to have crisp, clear, high resolution, and this camera goes up to 12 or 14 megapixels. I don't even use it that high. But to have really good pictures. And if you're a really good doctor, you will take time to have really good pictures. This is Dr. Joe Niamtu, LoveThatFace.com. Now, there's one other thing about this camera that's really cool, and that's the video capability. You know, these doggone little cameras now, they do really good video. And although I'm using a different camera, obviously, to film this, I'm going to take a little video footage here, and I'll paste that in to this video so you can see how well this does. So for video, you just push this red button, and we're on video. So, Alyssa, what's the name of your dog?
Her name is Chloe.
Chloe. And what kind of dog is Chloe?
She is a long-haired dachshund.
Okay, very good. Turn sideways once for me here. All right, turn back around this way. So that's how easy it is to take a video, and we'll use this for our surgical videos. A lot of our YouTube videos have been shot with this. So good little camera, Lesterdyne, and I hope that you also learned a little bit about some photographic pearls. If you want more information, it's Dinecorp, DINECORP.com. I'm Dr. Joe Niamtu, LoveThatFace.com. So how we doing?
Good, how are you?
All right, tell me the name of your dog.
Chloe.
What kind of dog is Chloe?
Chloe's a Dachshund.
All right, now just stay there 1 second here. All right, so here's a little picture of Alyssa's eye. That's a pretty nice video macro close-up. Let's show me your teeth there. Look at those pretty whites. So this camera will zoom in a lot farther than this as well. So we're actually filming this final segment here with the Lesterdyne simple digital solution, so you can see how the video works. I hope you've enjoyed this video, and if you want to look at other cosmetic facial surgery videos, you can check it out. Dr. Joe Niamtu, lovethatface.com.